Hello students, welcome back. So today we are going to start new topic, that is contraceptive methods of chapter 4, reproductive health. In the previous lecture we have covered about the RCH program, population explosion, population stabilization. So some initiative has been taken by the government for what? For the contraceptive method or for the birth control. Fine. So how we can control the birth rate for what? For that increasing growth rate. So one of the method which we have discussed about the contraceptive method. So as we have discussed that what should the characteristics of contraceptive? They should be user friendly. They should be least side effect, and it should be available at every places. So these are some characteristics which we have discussed here. So here we will study about the different methods of birth control. The first which I have mentioned here, natural method, and second one is barrier method, and third one chemical method, and fourth one is surgical method. Natural means nothing is artificial, everything is in a natural way. Barrier, we have provided some barrier, and in chemical method we are using some chemicals. Here in surgical, with the help of surgery. Now if you see all these four methods, the first three methods are what? The first three methods are temporary method. It means that it can be reversible because it's a characteristics of contraceptive. And the fourth one is a permanent method. Okay, so we will start with the first method, natural method. In this method what happens? We are providing, or we are giving some avoidance, or avoid for what? For meeting of sperm and ovum. So we can say that we are decreasing the chances of meeting sperm and ovum in a natural way. So what are the different method by which we can adopt it? Periodic abstinence means periodic related to what? Something related to periods or menstrual cycle. Again we will cover about the menstrual cycle because it is very important to understand about reproductive system. So what is happening? We are saying that for a particular period of time, the couple have to abstinence for the intercourse or for the coitus. So how they will track these things? In this method, the couple or the female can track her menstrual cycle, so that she can assume that which periods are safe for the coitus, as well as which periods are more chances of getting pregnant. So here, if you see the menstrual cycle, we know that it's of 28 days, and here what will happen? There will be formation of primary follicle, then secondary and tertiary follicle. We know that the first 5 days, 1, 2, 3, 4, 5 days are what? This is the menstrual phase. Fine. And the second phase of the menstrual cycle, it is known as what? It is a proliferative phase. We have done all about it. So in this menstrual phase, what will happen? There will be no intercourse. But after 5 to 10 days, I have shown some graph here. So on the 14th day, 14th day, what will happen? Ovulation takes place on the 14th day. That's why the luteinizing hormone also at the highest peak on the 14th day. This is the day, or this is the period where the ovulation takes place. What is the meaning of ovulation? Rupture of the ovum from the secondary oocyte, or the rupturing of the Graafian follicle. So here what will happen? Primary follicle, then secondary, then tertiary, then formation of Graafian follicle. So on 14th day, the Graafian follicle will get ruptured and the ovum get released here. So we can say this period is very fertile for the women. Why? Because there will be more chances of getting pregnant. But sometimes it happens that in a few females, this cycle is of 28 to 29. It may be 20, 29, 30. It may vary person to person. So how can we track all these things? Second reason, maybe due to some stress condition, maybe due to some changes in body, what will happen? This cycle can disturb, or it may happen that ovulation takes place in 13 or 15 days. Accordingly, it will increase the total number. Fine. So we can say that as the ovulation period, we will track it. So it may be from 10 to 17 days. We are taking these 3 days prior to the ovulation and 3 days after of the ovulation for a safety point of view. So we can say that 10 to 17 days are the fertile period of women. In this period, there are more chances to get pregnant if coitus will be there. Fine. So it is required that they have to avoid in this fertile period, and if they are going for the coitus, they have to take some protection. Okay, so in this periodic abstinence, what they are recommending? They are recommending that the couple has to in these days they have to prevent themselves for the coitus. Okay, now after 17 to 28 days here, these are the safe period, and 5 to 10 these periods are safe. So we can say this method is natural method. Now second one is coitus interruptus. This method is also known as withdrawal method. In this method, what happens before the ejaculation, what male will do? Male will withdraw his penis from the female reproductive tract, so that there will be no meeting of sperm and ovum, and fertilization can be avoided here. Okay, the third method is lactational amenorrhea. What is the meaning of amenorrhea? It means that stoppage of menstrual cycle. So here, due to the period of lactation, we know that as there will be delivery of women, what happens? There will be a lactation period. In this period, mother feeds to their babies, and it is assumed that during this period, what will happen? The prolactin hormone gets increased, and we know that when prolactin hormone will increase, what will happen? It will give negative feedback to the FSH and LH, and if there will be no FSH and LH, what will happen? There will be no ovulation. So we can say that in this period of lactation, there is very less chances of getting pregnant. Fine. So all these three methods comes under natural one. And what are the advantages of natural method? They are having least side effect, or we can say they are having no side effects. Okay, but there is a disadvantage. What is that disadvantage? Maybe the chances are not 100%. Why? In periodic abstinence, it may happen that cycle cannot be proper. Sometimes if the female skipped any month, what will happen? The whole menstrual cycle get disturbed. In that case, what will happen? There will be chances of getting fertilization. Right? In coitus interruptus, it may happen that in case of male, what will happen? Male, they are not aware about the ejaculation, and somehow it happens into the vagina. Or in lactation amenorrhea, this is the period for the lactation, but sometimes it happens that due to some changes or due to some activity of a body, what will happen? There will be chances that the ovulation has started, but female don't know that ovulation has been started. So what is required? This method is reliable up to 6 months. Okay, we cannot rely this method above 6 months, but sometimes it happens that after 4 months there would be ovulation. So it is required that the natural method are the safe method, but the reliability is not 100%. That's why it is recommended that the couple should adopt the another method, or we can say barrier method, or these methods are legal methods. Fine. Now we will come to the second method, that is barrier method. In this barrier method, the name itself indicates we are providing some barrier to avoid for what? The meeting of sperm and ovum physically. So what type of barrier it can be? There are different types of barrier. The first one is, I have mentioned here, condom method. We all know about these condoms. What are they? If we will talk about the condoms, so it is made up of latex sheath, and what they are doing, they are covering the penis. Here I have shown the male reproductive system, and here female reproductive system. So as we are talking about the condoms, so what happens? It is made up of latex sheath which covered the whole penis, and during the coitus, what will happen? If ejaculation will be there, so this ejaculation of the semen, it will remain in the condoms, and it will not able to reach up to the female genital tract. Fine, and by this method we can avoid the fertilization. Okay, so this condom can be in male as well as female. Okay, male condom we have discussed in which covering of penis, but sometimes female condoms are also there, which is known as femidoms. What you will say? Femidoms. In femidoms, what happens? Again, there is a covering of rubber, or we can say which will cover the whole cervix as well as vagina. If you will see the structure, this part is what? It is cervix and this part is vagina. Fine, cervix and vagina. So this cover whole cervix and vagina, so that what will happen, if male penis comes inside this genital tract, it will not able to penetrate up to the uterus and there will be no fertilization. Fine. Second method is diaphragms. And here diaphragm, cervical caps, vaults. All these three are almost same. We can say cervical caps are the miniature from the diaphragms, or these are the forms of what? Circular cap-like structure. What are they? Circular cap-like structure which can be fitted here into the cervix. So if they will fit it into the cervix, what will happen? The sperm not able to send the ejaculation towards the uterus and there will be no fertilization takes place. Fine. So diaphragms, cervical caps, vaults, what are they? They are made up of rubber, while the condoms made up of the latex sheet. Second thing about condoms, here we can say they are not reusable. Okay, once used, then we have to discard it. But here diaphragm, cervical caps, vaults are the reusable. This is the second point about it. And another point about the condoms, that they prevent the unwanted pregnancy. This is the first point. Second point about the condom, that they prevent the sexual transmitted diseases too. For example, we will come to know that bacterial STDs are there, viral STDs are also there. So the individual can prevent from all these type of diseases with the help of condoms. While in case of diaphragm, cervical caps and vaults, there are less chances to prevent from all these diseases. Why? Because there are chances that the penis can touch with the vagina in the part of female genital tract. Fine. And these methods are important for what? For the preventing unwanted pregnancy. Now, another method is IUD. This method is very important. Intrauterine devices. So what is the meaning of, I'm rubbing it here. So now we'll start with the IUDs. What are IUDs? Intrauterine devices. This question is very important. So how many types of IUDs are there? 3 types of IUDs are there. First one, non-medicated IUDs, and second one, copper releasing IUDs, and third one is hormonal IUDs. Okay, one by one we'll discuss it. Non-medicated IUDs, it means that anything which we are providing or inserting into the uterus, what will happen? They will block the entry of sperm. So we can say whenever we are using intrauterine devices, what it will do? It will act as a phagocytosis. It will act as a phagocytosis for the sperm. It means that it will check the entry of sperm, as well as what it will do. We know what is the meaning of phagocytosis? To engulf or to kill it. So here these devices having this ability to avoid this type of fertilization. Fine. So in non-medicated IUDs, example is very important. Lippes loop. What it is? Lippes loop. It's a function of our uterus. If anything will be here, what will happen? It will not able to implant, or implantation cannot be done by any material is inserted inside the uterus. So earlier what they have done, they have inserted some types of loop, or it is made up of plastic. So if you will insert inside the uterus, it will avoid the chances of getting pregnant. Now another one is copper releasing IUDs. What is the meaning of copper releasing? It means that it will release some copper ions. Examples are what? Copper T, okay, as well as copper 7. Have you heard about all these things? Copper T means somehow it will be in the shape of T. Okay, this T and 7 is of shape of 7. This type of things inserted into the uterus. Why? Because if we will insert this these IUDs here, what they will do? They will release some copper ions, and these copper ions will act on the sperms, and it will kill the mobility of the sperm. We know that if sperm is going from here towards the cervix through the vagina, what will happen? If in the uterus IUDs are present, so these IUDs will release some copper ions, and it will block the mobility of sperm, and sperm not able to move further. And if sperm will not able to move further, it will not reach up to ovum. What will happen? There will be no fertilization. So we know about different examples, copper T and copper 7. Along with this, another one is multi-load 375. These examples are important from the examination point of view. Copper releasing IUDs example, copper T, copper 7, multi-load 375. All they are having the same function. They are releasing the copper ions. Third one is hormonal IUDs. It means that they are releasing some hormones. So what can be the hormone? Progesterone, as well as LNG20. So these are hormones which will be released by the hormonal IUDs. And what they will do? Again, whenever we are giving progesterone or we are providing the progesterone, it will block the ovulation. Okay. So what it will do? It will block the ovulation, as well as what they will do? They will avoid the pregnancy. Fine. So these three types of IUDs are there to prevent the birth. Fine. So now we will start with another method, that is chemical method. The name itself indicates in chemical method we are using some chemicals. The first one I have written here, spermicidal. It means that something which have the ability to kill the sperm. So in the markets, different types of jellies, creams are there, so that the sperms can be killed by using this spermicidal. Here I want to add one thing. Whenever they are using the diaphragm, cervical caps and vaults, they are used with the spermicidal cream. Why? Because it may be happen that during the removal of these things, what will happen? Maybe the chances of sperms can get inside the tract or inside the uterus. So that's why that time these creams can be applied, so that whatever the sperm is there, it can be killed. Okay, so now spermicidal cream, the role of spermicidal cream is or the jellies or the chemicals to kill the sperms here. Another one is oral pills. We all know about the oral pills. So the medicines which taken orally, these are known as oral pills. Again, it can be of two types, COC and POP. What are the meaning of COC? It means that now COC. So what is COC? Combined oral contraceptives. Okay, it means that it is a combination of what? It is a combination of estrogen and progesterone. Both are included in this pills. Here what it is? Progesterone. What it is? Progesterone only pills. It means that in these pills only progesterone is present. So by using the estrogen and progesterone in the pills, we can provide to the female, so that what will happen? It will block the ovulation. What is the function of estrogen? It will stop the ovulation. And what is the role of progesterone? What it will do? It will act on the uterus, so that lining should not be maintained, or we can say it will hostile the uterus. Fine. And the second point about that, the mucus plug which is present here, it will block. So the cervix mucus will be hardened with the help of progesterone. These two function in a oral pills. Now here in the progesterone only pills, what happens? Only one hormone is present, that is progesterone. That's why we have written progesterone only pills. And action is same in progesterone. What is the function of progesterone? It will hostile the uterus, as well as what it will do? The cervical mucus will be hardened, so that there will be no entry of sperms into the uterus. Fine. So these pills, we must know the example of these pills. If you talk about the COC, have you heard about the Samala tea? What it is? It's a COC. It means that both estrogen and progesterone is present in this malady. And the example of this POP is Saheli. This question is very important, as we have discussed in first lecture also. In Saheli, why it is important? The first thing, because it is manufactured in India, and this is very effective, and there are least side effect of this pill. As well as another question about Saheli, who has manufactured CDRI, Central Drug Research Institute, which is situated in Lucknow. These are the questions. Now, when we are talking about the oral pills, so we know that it should be least side effect should be there. And another point about the COC is that in case of that one, the female should take it 21 days. Okay, and here Saheli, the female can take once a week. It means that it is more effective as compared to the COC. Why? Because they have to take 20 days. So how they will take 21 days? It means that we know that the menstrual cycle of 28 days. So first 5 days, it will start from 3 to 4 to 5 days, wherever the menstruation of female is less. So, and take up to what? Up to the 28 days. After that, it will leave for the rest of the days. So like this, they have to take these pills. Fine. And here they have to take only once a week. So this is all about the chemical method. We have done first method, second method, and now we will start with the third method, that is implant. What is the meaning of implant? To plant something at one place, or here we are talking about the female part. So these implants can be done where? Into the body, or how we can go through it. Two methods are there: implantation or injection method. If we are going for the injection, again they are providing some hormones like progesterone directly into the with the help of injection, and the famous one is Depo-Provera. These are the injection which can be injected inside the body, and what it will do, it will act on the uterus, so that there will be no proper implantation and fertilization takes place. Fine. Another one is the implantation method is in your NCERT it is shown that this type of figure. Okay, this type of figure, what it shows that this thing can be implanted in beneath the skin, and it is the type of simple surgical method. And when they are keeping inside the body, what they will do, they will act on the uterus, and in this method again the fertilization will stop here, and it will not able to fertilize with the ovum here. For these things we are having different implants. Now another method is emergency contraceptives. This is very common. What is the meaning of emergency? If any emergency is there, it means that somehow due to some mishappening, for example in case of rape, what happens in case of some unwanted pregnancy, at that time the female can take these emergency contraceptives. Examples are I-pill. But what is the important thing about these emergency contraceptive? It should be taken within 72 hours. Okay, and it will be more effective up to 24 hours, and up to 70 if after the coitus activity, if any female takes 72 hours, if there will be no fertilization takes place. If there will be fertilization, then what will happen? There will be no implantation. Fine. These are some method of chemical. Now the fourth one is surgical method. What is the meaning of surgical? With the help of some surgery, what they are doing, they are avoiding the fertilization, and we have discussed that this method is permanent. It means that it cannot be reversed back. So in this we are having two types of method: tubectomy and vasectomy. What is the meaning of tubectomy? Here I have shown the diagram. So if you recall the female reproductive system, this tubectomy done where? In the female, and vasectomy where? In the male. Don't confuse with these all point. Why? You can memorize as like this. We have done copper T in where? In female. So same thing, T is here. So we can say again it will be in female. And another one you can it is obvious that another one will be in male. So tubectomy and vasectomy. These are the surgical method. It should be done by the skilled nurses or the doctors in a proper way. So we were discussing about the tubectomy. It is done in the female part, and this part is what? These are the fallopian tube. So in this method they are having some cut, and what they will do, they will tie this part of fallopian tube, so that what will happen, if sperm will here, it will not reach up to the ampullary ischemic region where fertilization takes place. So what they are doing, they are cutting or they are tying the fallopian tube so that there will be no fertilization. Same thing in case of vasectomy. If you recall the male reproductive system, they are what? Vas deferens. What are they? Vas deferens. What is the role of this vas deferens? They will take the sperm from testes towards the penis. Fine. So in this vasectomy, what they are doing? They are cutting, or they are surgically cutting and tying this part. What will happen? The sperm which is forming inside this testes, they will not able to reach where? Up to the penis, and afterward during the coitus they will not meet with the ovum, because we have tied this part, and the sperms are here only. Fine. So these are two methods by which we can avoid the unwanted pregnancy, and if any couple uses this method or adopt this method, obviously it will helpful for the country, for what? For controlling the population. Fine. So here we have done about the contraceptive method. That's all for this lecture. Thank you.